I would like to ask you how pollution,
Yes.
lifestyle,
Yes.
I mean, these are self-inflicted to an extent, is
Yes.
affecting our eyesight.
Okay, if you let me just take something which is more affecting the eyesight from a fact that it could be more debilitating to the vision, and that is your lifestyle. So, by lifestyle, what we have done is the kind of junk food that we eat, the lack of exercise, sedentary lifestyle, etc., etc. So we are becoming the diabetic capital of the world. And diabetes, as I told you, is having an ill effect on the eye. And even in the most developed countries, you can delay that ill effect, but you may not be able to treat it fully.
Right.
So what happens is that because of diabetes, there is some amount of mismatch between the oxygen that is being supplied by the altered blood vessels to the retina and the requirement. So that causes the formation of new blood vessels in the retina, and it causes leakage. And this can lead to sight threatening complications like vitreous hemorrhage, like bleeds, like new vascularization, etc., etc.
Right.
So that needs to be treated. So given a long enough life, a diabetic will develop diabetic retinopathy. But if a person has good glycemic control, that means the sugars are within good control, he does not smoke, lipid profile is good, and BP etc. is controlled, then the chances of the diabetic retinopathy occurring go down. So this is from, then you have the lifestyle. We are always on the high street, so you have hypertension that's increasing. Again, hypertension can have an ill effect on the eye. So these are lifestyle related diseases which happen systemically, which can cause problem on the eye.
Right.
Overworking will give you strain. One doesn't give rest to the eyes, so by the time you have asthenopia or eye headache, etc., by the time you work, say, 1 hour on the computer, 2 hours on the computer, you don't feel well, and that makes you irritable and headache, etc., etc. Apart from that, you raise the question of pollution.
Right.
Now, pollution, as you nowadays, it was a lot in the news, etc. There is something called as particulate matter. There is something called as noxious gases, etc. Now, what happens is that all of them, the eye is an exposed portion. There is a lot that is written about kids getting bronchial asthma, etc., because that again is something that you breathe in, and that the mucosa gets this thing. So similarly, the conjunctiva of the eye or the mucosa is an exposed part. So when this is getting exposed to these allergens, they would cause an allergic conjunctivitis. That is point number one. And the second thing is that the tear film, that a normal tear that is produced, that becomes labile. That means there is an instability of the tear film and it breaks up.
Right.
So there is a great increase in the incidence of dry eye.
Right.
As it is, when a person ages, the amount of tears that are secreted, especially in women post-menopausal, they tend to go down slightly. But if you get this compounded by pollution, constant irritation, constant instability of the tear film, the lipid profile of the tear film gets altered. So that causes a severe amount of dry eye.
Right.
Now, dry eye is an irritating thing. It may not be blinding. So what it does is that your eyes do not feel fresh. The luster of the eyes goes down. The color of the conjunctiva, you feel that it's lusterless, and then you have irritation, chronically inflamed eyes, red eyes. By the time you go back in the evening, scooter, motorcycle, if you have done and you have had all of those, so you would feel smarting, burning, photophobia, watering, etc. So those are the things that happen. So I think these are the things which environmental pollution are bringing about to our eyes.
Doctor, as far as the infrastructure is concerned,
Yes.
I mean, India has obviously moved in leaps and bounds in terms of
Yes.
infrastructure all across.
Yes.
And medical care is not left behind.
Yes.
But still, we see a lot of gap in the core sector,
Yes.
rural and the city.
Yes.
I would like you to comment on the current infrastructure and how they are spread out.
See, typically what is happening is that for any eye specialist or an eye hospital to be sustaining itself, you have to do X number of surgeries or you have to see X number of patients to make it viable. When you go to a small place, the number of patients that are available would be less. So the infrastructure that is the bottleneck is not that you should have an eye hospital in every village, but the ability of a person to travel some distance to get a specialized eye care should be facilitated, and that's lack of money for people to travel, that's lack of roads, that's lack of vehicles, etc. So that is what is causing. So ultimately, in India we have about 20,000 ophthalmologists, and we should have at least 1 lakh as per the normal this thing, and it's only when you have more ophthalmologists that they will permeate in deeper. Just now the normal typical approach is that there are societies or organizations which go to villages, set up eye camps, and then they transport the patients to the base hospital to do the surgeries. But obviously a lot of times they are done as bulk surgeries.
Right.
And sometimes you could have adverse events happening which could kind of
And we hear about that.
yeah, you hear about that. That's why I raised this point. So ultimately, if a person is able to communicate on a daily basis and not wait for an eye camp to be set up or something like that, that is what the infrastructure requires. Mobile satellite telemedicine would be one way forward. That is that you could have, like for example, we have this room, this similar kind of equipment could be fitted into a van, and one could go and one could screen out patients and then ask the patient that you need this and you please come to the base hospital, get the surgery done, and not as a horde, but on a continuum basis. So that's what I feel, that's the way forward for India. That is what needs to be done. Otherwise, infrastructure is coming in thick and fast. If you look at city hospitals for ophthalmology, we have technology that is best in the world. There is, I would say, no technology that's available, say, in US, which we don't have. Maybe at times we get technology faster than them because the FDA US at times takes much longer for them to get approvals. So, cutting edge technology, skill set of doctors, doing more number of cases, being more proficient, being able to adapt them to Indian circumstances to keep the cost low, etc. That's all there. But ultimately, the poor people who are in the far-flung areas, it is the inability to kind of travel to places where you have eye care. That is the bottleneck, I would say.
Doctor, thank you for your time. It's really a pleasure talking to you. And on behalf of all our viewers, I really thank you.
My pleasure.